So there kind of is a Lyme vaccine for horses. It's not FDA approved. It's actually the canine version, and it's used off-label by some veterinarians. And there has been some study done as to see the efficacy of these canine vaccines in horses. And what they've discovered is, yes, they do produce antibodies, meaning that the horse shows an immune response to these vaccines, which is the goal. And in horses, this is usually done by giving the horse 2 vaccines 3 weeks apart and then boosting every 6 months or so, because those transient antibodies don't last a long time in horses. And we can do blood tests to see if your horse has been exposed to this bacteria transmitted by ticks. And so when it comes time to diagnosis, it gets a little bit more complicated, because is your horse showing a positive test result because of the vaccine, or is it actually going to move into full-blown Lyme disease? Or because Lyme disease is so vague, is it something else? Is it some other neurological problem, like EPM or an injury or degenerative arthritis or something that needs to be really fleshed out? And that's where it gets really tricky for horse owners and veterinarians to kind of narrow things down. And a lot of times the diagnosis of Lyme's is actually a result of eliminating literally almost everything else. And as stewards of our horse's health, it's important to remember that giving a vaccine or not giving a vaccine is not going to be enough. You need to treat like everything holistically, and that includes your horse's environment and your horse. So when you're riding, be mindful of where you're going. Ticks like taller grasses. They like to fall from trees and things like that, which is great. When you get back from riding, or when you bring your horse in from turnout, you need to inspect them everywhere with your eyeballs and your fingertips. Manes, tails, forelocks, elbows, all those like wrinkles in there, groins. These are all places that ticks love to latch on and hang out. And then we just have to try and not retch when we do find a tick, because can't even talk about it. Gross, so gross.